All right, Jacob, you count us down whenever you are. Hey, Iowa, it's Congressman Zach Nunn. I just wanted to reach out today with some incredible healthcare professionals as we talk about a challenge that is expanding not just here in Iowa, but across the nation. A lack of qualified nurses, particularly in our hometown communities. Today, to tackle the nursing shortage, not just here in Iowa, but across our country. And making sure that we have nurses not just in metropolitan areas, but also in those underserved communities right here in Des Moines and across our rural communities in Iowa. The bipartisan, simply called Train More Nurses Act, will require the U.S. Department of Health and Human Services to develop a plan to utilize our grant programs and to address the nursing faculty shortage, which in turn will help fill more nurses in those critical positions. I'm grateful to my colleague from Nevada, Dina Titus, for joining me and helping lead on this important issue, because this is not a Republican or a Democrat issue. For this to say a few words about both the nursing shortage and some of the work we have going forward. So Aaron, with that, back to you.
Good morning, and thank you so much for being here today. My name is Aaron Todd. I'm the CEO of the Iowa Primary Care Association. We represent community health centers all across the state of Iowa. There are 14 of them that deliver services at over 100 sites all across the state of Iowa. They provide integrated behavioral health, primary care services, and oral care services. We have a lot of work that we need to do in this space. Community health centers hire 2,000 staff all across the state. They workers all over the state of Iowa, and over 300 of them are nurses. And so they're a big part of our workforce strategy and for delivering care to Iowans all across the state. And so this is an important piece of legislation to address the pressing needs of our workforce and our ability to provide care to patients all across the state. One of the things we were struck by in working with Representative Nunn's office is the first time that we met with him.
Provides a spectrum of services to nearly 40,000 patients every year in our communities where we serve, which is in Polk County, Story County, and Marshall County. We have been caring for Central Iowans for 42 years, and we are uniquely positioned to provide care and supportive services to under-resourced individuals and families living in Central Iowa based upon the local needs of our communities. This is work that we believe in passionately, and we are aiming to always provide quality and accessible services to our patients with kindness and compassion. Over the last several years, we definitely have faced many challenges, including staffing shortages. And when we visited, as Aaron mentioned, when we visited with Representative Nunn at our Eastside Clinic last year, we did share with him the workforce challenges that we were experiencing, and we certainly appreciate his responsiveness to those issues. Our care teams here at Primary Healthcare are dedicated to serving all patients, and in order to do so, we must have a strong workforce, including nurses. Access to care is one of the biggest barriers that our patients face, and we have wonderful facilities, and we're across throughout Polk County and Marshalltown and in Ames. We have 7 different locations, and we have a wide range of services, but we can't serve patients if we don't have the staff to do so. And as Aaron indicated, it started prior to COVID, really intensified during COVID, but we're really still experiencing those significant shortages. We have a couple of our recruiting team in the back today, and they've worked really hard to recruit nurses, but it's very difficult, and we continue to have critical shortages in our clinics, which limit the abilities of us to serve patients. So when you talk about we're in schools, where we have school-based health clinics, those clinics are seeing shortages in nursing staff, which means our kids struggle to get access. That's not what we want, but we can't do that without staff. So we are very appreciative of the fact that Representative Nunn is here today and is talking about this legislation, and we look forward to working with him in the future. Having staff to care for our patients is really important, and it allows us to do the good work that we do to help improve the lives of Iowans. So thank you.
Thank you, Kelly. I appreciate it. Aaron, Kelly, thank you to the team here. So let's get down to the brass tacks of this. Look, I have visited rural hospitals in counties like Union, where for them to just keep the door open to service that community, they are in desperate need of nurses. We collectively have visited teams here at PHC as well as our larger groups, and we've seen doctors who are overwhelmed because they don't have the intake available for the critical care that's necessary that only nurses provide. Our nurses have gone through real trauma. From COVID onwards, this is a workforce that has been beleaguered. And we should recognize immediately that these men and women who are the frontline